Good afternoon, everyone. Welcome to today's town hall. We'll get started in just a moment. I'm going to leave at least 30 seconds so that as many of our participants as possible can log on and make sure that your volume is working, etc. Just give it a moment, let our participation rates get up a little higher. Okay, well, we'll kick things off. Good afternoon, everyone. I'm Aaron Level. I'm the Vice President of People, Culture, and Communications. Welcome to our HHS Town Hall for today, February the 1st, 2024, start of Black History Month. We've got a very packed agenda today, so we're going to get right to it as quickly as possible. A little housekeeping off the top, just a reminder, we will have the Q&A function open today, and you can use the Q&A function to pose questions to our panelists or on the topics that are being presented or other questions you have, and they'll do their very best to type an answer into that function. And you can see the answers stack up in the Answered tab within the Q&A function. We'll leave our chat function for our celebrations, and we'll have a moment at the end of our formal agenda today. So as we're going, think of questions you might have, but also think of celebrations and shout outs you might want to give to a team or a colleague or something that's happened in the organization that's worth noting for everyone. You'll have the chance to type your celebration in the chat function and I'll read it out, or you can raise your hand and we'll ask you to give your celebration live. So those are the housekeeping items for today, and I'll turn things over to our President and CEO, Rob McIsaac, to kick things off.
Thanks very much, Aaron, and good morning, everyone, and welcome to our monthly town hall. As always, I want to start by acknowledging that we're privileged to provide care on lands that Indigenous peoples have called home for thousands of years, and we recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. As Aaron mentioned, today is significant because it marks the first day of Black History Month. I'm going to have a few comments about that, but as you can see on today's agenda, we've got a number of substantive items to bring to your attention. But if I return to Black History Month, celebrating and recognizing the history and accomplishments of members of the Black community really gives us an opportunity to honor their legacy and contributions. I think one good example is an individual named Vivian Thomas, who was co-creator of the BTT shunt, which is a medical device used in pediatric heart surgeries. Way back in 1944, Vivian Thomas was a laboratory technician who worked alongside of Dr. Alfred Blaylock and actually helped to guide him through this revolutionary pediatric heart procedure at Johns Hopkins Hospital in Baltimore. Mr. Thomas had dedicated his work to development of this surgical procedure alongside doctors Blaylock, as I mentioned, and Helen Taussig. Despite the fact that he was a co-contributor in the report published in the Journal of the AMA, the American Medical Association, about the procedure, there was never any mention of him. The procedure became known as the Blaylock-Taussig shunt procedure, BT shunt procedure, and it's remained that way for years. However, in recent years, members of the medical community have been pushing for renaming of the procedure to the Blaylock-Thomas-Taussig or BTT shunt, which would give appropriate recognition to Mr. Thomas's vital contribution to this procedure. So I'm happy to share that HHS and McMaster Children's Hospital are working with our provincial peers to formalize and celebrate the renaming of the procedure to the BTT procedure across our organizations. So we'll keep you informed how our efforts are going in that respect, but we think it's a neat initiative for us to pursue and very appropriate given that it's Black History Month. Thinking more broadly, we have a duty as healthcare providers to understand and address the challenges and barriers that continue to persist for Black colleagues, patients, and their families. That includes understanding how race can influence the care that patients receive, and ensuring that every patient, irrespective of their race, receives appropriate access to good quality care. We've made lots of progress in our efforts to create a culture of inclusion at HHS over the past while. We've outlined our intentions in our 5-year Equity, Diversity, and Inclusion Plan, which we've reported out to you previously. Just the name of that plan tells you there's lots more work to be done. So this journey really requires the commitment of everyone who works here at HHS or who is otherwise involved with HHS. In the weeks ahead, I would just encourage you to access the calendar of Black History Month learning opportunities on the EDI section of the Hub. There are lots of great resources available there, and I want to thank our EDI team for their work to create and curate those resources for the benefit of all of us here at Hamilton Health Sciences. Now, usually I would call on Sharon Pearson, our Chief Operating Officer, Chief Nursing Exec, to give us an update on hospital operations. So Sharon is away today, and I'm going to try pinch hitting for her on this. So let's go to the next slide, please. So as you can see from this slide, we continue to treat patients in connection with respiratory and viral conditions. So that season continues. We, I think, are going to be hearing from Dr. Mertz a little later, so he can confirm, but hopefully the worst of the respiratory season is behind us. Next slide, please. We are continuing to see a very high level of demand for care across all our sites, and of course, that continues to be a challenge for us. Occupancy rates continue to be very high, as you can see. Next slide. Let's say our adult sites in particular continue to be under pressure. Last month, we set a record, not in a good way. Our teams at the Juravinski cared for over 500 patients at one point. That's the most patients we've ever had at the JH. Just to give you some context, if you're not familiar, that site has just over 400 beds, so really very significantly over occupancy. Our adult sites across HHS are continuing to provide care for patients in unconventional spaces. It's it's not great for our patients. It's not great for the people who are caring for them, given that they're not in the kind of beds we'd like them to be in. Patient flow also continues to be impacted by a number of outbreaks and ALC pressures. We do have some good news. We have opened a combined 16 new level 2 critical care beds at JH and the General. So that is a help in respect of these very high demands we're seeing for care. Next slide, please. If we turn to the Children's Hospital, McKids is also seeing an increasing demand for care. Bruce could, of course, comment more on this, but ED volumes were stable last month, but they are higher this year than they were last year. On a positive note, pediatric surgical and ambulatory activity is increasing, so hopefully we're having some positive impact on people who have been waiting for that care. As I said, Bruce will address this further in his update on growing McMaster Children's Hospital. So I'm going to pass it back to Aaron, but maybe just finish this section by saying, given the extraordinary demands being placed on everybody at Hamilton Health Sciences, I just wanted to express my gratitude and appreciation for the work that everybody's doing to help us meet the needs of our community in very trying circumstances. So thank you all very much. Aaron, back to you.
Okay, thanks very much, Rob, for the update. And next up on our agenda, we have Dr. Dominic Mertz, who is our Medical Director of Infection Prevention and Control, to give us an update on respiratory viral season and what's happening now as of February. Dominic, I hope things are calming down. What do we need to know?
Yeah, thanks, Aaron. Yeah, we are heading into the right direction for sure. So providing a quick update on the epidemiology, on the Omicron soup, and it's not a heads up anymore. If you have already read the memo, the changes to the universal masking policy. Next slide. You're used to these figures in the meantime. This is from Hamilton Public Health, data on Hamiltonians highlighted the last 4 weeks, so the first 4 weeks of 2024 versus the same 4 weeks beginning of 2023. And what you can see on top is that there's less death, so certainly good news. There's much less ICU admissions of patients with COVID. That's the second from the bottom. And in between, you see the number of patients who are COVID positives and in hospital. And that's roughly similar to last year. We'll provide some more data on that. From a wastewater perspective, which you see at the bottom, we have peaked end of December, beginning of January, are currently much lower than we've been last year around the same time, where we had our COVID peak in the wastewater later in February. Next slide. These are ARI positive patients in hospital. So COVID in red, flu in orange, and RSV in yellow. So the three most important respiratory viruses, I would say, across the legacy LIN, and HB. Here highlighted the first 5 weeks this year versus 2024. And you can see from a COVID perspective, we had a peak in terms of hospital admissions in late 2022. We didn't have much of a peak by the end of the year. This peak this year is somewhere between those two peaks that we had during winter last year. But what you can see is that in addition to having had the peak for COVID, we also had the peak for influenza at the same time, and that resulted in the struggles we had going into end of December, and that's resolving now. As you can see, the numbers have come down by almost 50% since the peak end of the year, beginning of January. Next slide. Looking at the Children's Hospital, we would have had the peak earlier, as you would expect, because RSV typically peaks early, and that's the main driver of hospital admissions in children. So that was end of November. Ever since, it slowly comes down. Currently, interesting enough, rhinoenterovirus is the most common respiratory virus that we find again, which is usually the case September, October. So some reemergence there. Flu is slowing down here as well, and very limited COVID and RSV activity at this point in the Children's Hospital. Next slide. COVID outbreaks, Hamilton's. This is from PHO, so Public Health Ontario. You can see there's a gap there. Those are the holiday weeks where there's no number of outbreaks reported. You can look at the yellow line, which is this season, versus the dark orange line, which is last season, and things look quite similar. We had, across the province, more COVID outbreaks throughout November, similar numbers in December and now in January, where you see quite a drop there going into the fourth surveillance week of January. And further up, you see how things look like in green, 2020, 2021, and with the first Omicron wave, 2021, 2022 in red, the very sort of high peak up there. Next slide. ED visit, similar picture. much less activity, as you can see in the upper left, in the 0 to 4 year group than last year. And you all remember how we were struggling with RSV, in particular in that patient population last year. Looks very normal, or actually lower than expected this year. And for the other age groups, within the range of what was expected, and again, peaked end of December. Next slide. Just the US picture, because I showed this a few times. At the right bottom, the smaller figure is how things looked around peak by the end of the year. Lots of purple there and dark red. US is the same that we see in Ontario. Things are improving. There's still, particularly in the south, quite some activity of respiratory viruses, but has significantly decreased, even more so in the north, which is similar to the picture that we see in southern Canada. Next slide. The Omicron soup, as I mentioned at my last rounds, we expected back then that the new sublineage JN1, which is one of many Omicron recombinants that we have, will be becoming the predominant sublineage, and that did happen. You see the data here, more than 60% by the end of the year or beginning of January. Next slide, you see the forward nowcast. It's expected to be somewhere between 80 and 85% at this point. So JN1 is certainly predominant. That has pushed the other sublineages sort of away. But as you can see, it hasn't resulted in a new peak of COVID activity in the population. Next slide. Okay, in summary, the most relevant ARIs have peaked: COVID-19, flu A, and RSV. As I mentioned, rhino intro seems to have a little bit of a re-emergence. We typically see that only happening in September and October. In terms of COVID, similar number of positives in hospital over this season as last year, with different timing in terms of peak or peaks. But we saw less ICU admissions, lower number of deaths, and a similar number of outbreaks across the province. We did see more influenza admissions, including ICU admissions, I felt, and certainly more outbreaks than last year that were influenza related. From an RSV perspective, I think it's fair to say it was a more normal and more benign season than we've seen last year. JN1, now the dominant COVID-19 Omicron sublineage at this point, but hasn't resulted in a new peak of COVID activity. And then finally, on my last slide, as you may have already seen in the memo that went out earlier today, we are aligning our practices in terms of universal masking with St. Joe's and the majority of other organizations across Ontario West, and will be limiting the requirement for masking for staff for direct patient care or direct patient contact only moving forward. And this goes in effect tomorrow, as you would have seen in the memo that went out. Those are the updates from my end. Thank you, Aaron.
Yeah, thank you very much, Dr. Mertz, for the update today. Next up on our agenda, we're going to dive in a little bit further on Black History Month. We have Sarah Adjicum and Shannon Kitchings with us today from our Human Rights and Inclusion team, and they're going to walk us through what do we need to know.
Good morning, everyone. My name is Sarah. I'm the newest member of the EDI Human Rights and Inclusion team here at Hamilton Health Sciences. And my colleague Shannon and I will be providing an overview of some of the programming and events scheduled for Black History Month this February. So Black History Month is an opportunity to celebrate Black history and culture, and to learn and reflect on the ways in which we can all participate in dismantling systemic anti-Black racism. Collectively, we can and we must engage in these processes and work towards becoming anti-racist, not just in February, but all year round. And of course, this can be done by attending trainings, lunch and learns, and other learning opportunities that Shannon will touch on in a moment. And of course, doing the personal work to be anti-racist in your day-to-day life. So what you're seeing here are some Zoom backgrounds, and I'm excited to see that folks are sporting some backgrounds this morning. I've got one behind me as well. And these backgrounds are available on Zoom to all Zoom users here at Hamilton Health Sciences. Do note that some of these backgrounds have been unveiled today, and the other Black history backgrounds will be available likely sometime next week. So do look forward to that. And we've got many more ways for staff to engage in honoring and celebrating Black History Month. Next slide. So after such positive feedback over the past 2 years, and the team has collaborated to update the Black History Month calendar of learning opportunities. Here is a screenshot of the first page. A link to the calendar is on the hub in the EDI Human Rights and Inclusion Team Hub page now. And also on the EDI and Human Rights Team Hub page, you'll find the poster of events and activities. It lists a number of ways you can participate in recognizing and celebrating Black History Month in the community. So if you're looking for events for yourself, your friends, and your family, please do check out the poster or the events page on the Team Hub page for highlights. Next slide.
Thanks, Sarah. The events page will be updated monthly, so you can check out what's going on with the EDI and Human Rights team in terms of events and learning opportunities on an ongoing basis. But for February, you can see here a snapshot of what is going to be available for you. So along with the calendar of learning opportunities, we are going to be doing something every week for the course of Black History Month to allow folks an opportunity to learn, to engage, and to celebrate. So next week, coming up on February 8th, we're doing a film screening of a satirical documentary called Patty versus Patty, which touches on the patty wars of 1985 in Toronto, when Jamaican patty vendors had to go to bat for the name of their product with the government of Canada. It's a good example of some institutional racism that occurred, and it's also a light and interesting way to take a look at some of the Black history in our local area. The following week, I'll be doing a lunch and learn to help people understand the new anti-racism policy that rolled out in the summer. I know that some folks and some leaders in particular have already had some experience and exposure to it, but I wanted to open up a space to make sure that people could ask questions and get a little bit of an idea of the direction HHS is going in terms of addressing anti-racism and supporting our diverse staff. On the 21st, I'll be hosting a webinar that is exploring Black music in North America. We'll be touching on a number of artists and a number of musical lineages and how those relate to Black history in our area. And we are also hosting another Black Staff Affinity Group meeting. We've been meeting for the last year and a half or so, and we are open to new members. If you identify as Black or you have colleagues who identify as Black who might be interested in joining us, we've got some initiatives coming up that are really exciting and really essential to some of the work and development that HHS is doing around supporting Black staff and around anti-racism approaches. So feel free to reach out to me for that. And there will be upcoming an ethics grand rounds that will be towards the end of the month on February 28th. So we'll do some promotion for that further on in the month. So do check that out. And if you want to come to any of these other events, you can check out our hub page for information about it. But essentially, you're going to be emailing me and asking for the links. So you can reach me at kitchings@hhsc.ca. There will also be, as you've noted there on the 22nd, a special menu as has happened in the past. So Hamilton Health Sciences Volunteer Association will be doing an Ethiopian themed menu for Black History Month on the 22nd. It'll be available at Nora's Bay West and Courtyard locations. I've looked at the menu. It looks delicious. So check it out and enjoy some celebration of Black culture with the Ethiopian menu for Black History Month. And finally, as Rob mentioned at the beginning, there is some work being done around recognizing the work of Dr. Thomas Vivian's work in the BTT shunt process and renaming. And so there's more to come on that. We've been working with the other pediatric hospitals in Ontario to do this work and to support this recognition of history that has been erased. So we will have more announcements coming up in the month of other things that you can participate in as well. But here is a taste of what's to come. I hope to see you at lots of these events. And I will throw it back to you now, Aaron. Thank you so much.
Yeah, thanks very much, Shannon and Sarah, for that. That looks like a stellar roster of events and noted Ethiopian lunch in February. Okay, next up we have Bruce Squires, who's our president of McMaster Children's Hospital and our VP of Women's and Children's Health. And Bruce is going to give us an update on the incredible amount of work that's going underway in growing McMaster Children's Hospital. Bruce, what's the update today?
Thanks very much, Aaron, and thanks for the opportunity. Let me first start and add my voice to those really celebrating and thanking Sarah and Shannon for these, the great resources, the great education, your leadership as we recognize and celebrate Black History Month. Folks, as we had promised, we would come back in the course of the Growing McMaster Children's Hospital to provide that update. And so I appreciate the opportunity to join you again today. Just a reminder, what is this? Well, if we look back, it's a product of a whole bunch of kind of situations and actions, but I'd summarize it as it's reflective of a recognition by governments of significant undersizing in the pediatric health system in general in Ontario and at MCH and in particular. And as the implications of that undersizing on access and quality of care for children and youth became more clear to the public and governments, and that truly was supported by really significant advocacy here and across the province and country. Then investments started to flow, and you can see over the last 18 months or so, MCH has received approximately $48 million in new ongoing operational funding. And so that really is why we have ended up at a project which we entitled Growing MCH. How do we operationalize that investment to drive better access and quality of care for children, youth, and family across our region? Go to the next slide, please, Alyssa. So the project, well, the Growing MCH project has been identified as an HHS corporate project on the corporate strategy, and you've heard Rob speak to that a number of times. To operationalize that, we have created a steering committee, including family advisors who participate, as well as engagement from our youth advisory committee. At its core, it includes 8 clinical enhancement streams. So those are groupings of the areas where the investment needs to be implemented, as well as 5 plus, and we're flexible on this, but functional support services streams, i.e., things like human resources support, like navigating the space, like driving our reporting, that also really are critical to the operationalization of the investments. And I'll just highlight here that we've also, with the support and leadership of the EDI team, we've created a cadre of 13 EDI champions drawn directly from staff across the hospital, and they're currently supporting this work across 6 of our program areas, and really providing advice across the entirety. Could go to the next slide, please. So let's talk about where we are right now. And if I focus first on the inpatient area, to acknowledge that this investment has led to us creating over the last few years 2 new level 3 ICU beds that are funded, a brand new 4-bed level 2 dedicated step down unit, 8 new funded pediatric medicine beds, 4 new funded 3Y post-surgical beds, and missing from here 2 new eating disorders beds. So significant increase in our inpatient capacity, all of which has been operationalized. You see here reference to a rapid assessment service within RED, and that certainly has been critical to enabling better triage, better addressing high volumes of ED patients. And when we do that well, we know that that provides space and bandwidth to focus on sicker kids, particularly during volumes of periods of high volume and surge. And, this last bullet, I really want to emphasize that. And it's about, what a difference a year makes. In fact, in this past November and December, we saw higher volumes in our emergency department than we saw in the fall of 2022, where we really talked about the triple demic, and we were overwhelmed. Well, we had higher volumes this past year, but in fact, our wait times dropped by 31%. We saw a significant reduction in our admit to no bed volumes and much shorter periods of waiting in the ED to be admitted to one of our floors. So a massive difference that was driven by the increase in our capacity. If we go to the next slide, I'll show the same thing as it relates to the surgical investments. We have been able to open a brand new same-day overnight unit that first and foremost means that some of the patients who previously would have been admitted to one of our busy and often over capacity inpatient wards are now able to be cared for in the same day overnight unit in perioperative and then discharged home in the morning. It also facilitates our emergency surgeries. And again, it really has had a meaningful impact on our surgical cancellations. What kind of meaningful impact? Well, we have not had a single cancellation of a scheduled surgery throughout this past fall and winter season. We had one day delay related to a PICU pressure. As Rob already identified, we completed 55 more scheduled surgeries just in the month of December than in previous years. So a great celebration reflecting the difference that a year makes and the impact of these investments. We've also implemented the brand new extensive needs service, and you've had an update on that previously. We are in the process of implementing a regional pediatric palliative care program. That's our Koala program rolling out to clearly be a regional program. And of course, that is one of the additional steps towards our vision of a hospice here in Hamilton. And I'd also, really emphasize this last set of bullets. $7 million of this investment is dedicated to increasing the access to our many pediatric and pediatric surgical outpatient services. And already we've seen a 14% increase in the number of patients that we've been able to see within those programs, even while we were ramping up the recruitment of the new teams. This month, we are expanding our use of extended clinic hours from 2 to 4 days each week. 10 services are involved in 15 plus patients. So this is 15 plus physicians. So this is another opportunity for us to reduce the significant wait times that our children, youth, and families have been experiencing and that have been growing over the last few years. If we could go to the next slide, those are just some of the key investments across across inpatient care, emergency department, outpatient, and perioperative care. You also see here a number of targeted programs, all of which have received significant additional investment to grow their service lines and again to enhance quality of care and access. In the coming months, we hope to provide additional details to you on each of these areas and how that investment is implemented and the impact that it is having, as I said, on access to care. You can see the breadth here, and I'll just highlight, for example, our hemoglobinopathy program growth, really targeting in particular disparities associated with sickle cell disease and access, care, and treatment, as well as our gender diversity program. Such an important innovation here at Hamilton Health Sciences. And that's just two of these examples. So if we go to the last slide, okay, well, this is really a next step slide, but it's also an update. So we're already close to 80% of that recruitment of 300 plus new staff and clinicians. That's a wonderful progress, and such great thanks to everyone involved, including, of course, the human resources team, the communications team, and all the program leaders and staff. We need to operationalize space. We need to optimize space in order to accommodate those clinicians and the additional patient volumes. And so that work is continuing, and we've celebrated and thanked, and I'll do that again, the teams from facilities, for example, and so many others as they've driven that work. Our communication team is helping us to really amplify this internally and externally to our community through patient and family stories, again, diving deep into various programs and hearing directly from staff. I'll maybe close on the last piece. Certainly always parking is very important to our patients and our families, and of course to our staff. And I want to thank Kelly Campbell and her team as they are moving mountains to really create new space, new parking spots in such a pressured environment, particularly at the MCH and Mumsy site. So maybe, Aaron, I'm gonna stop there and close with a sincere thank you to the hundreds of folks that are really helping us to realize the vision of growing MCH. Back over to you.
Yeah, thanks very much, Bruce. Really great update today, and nice to see all of that work progressing. Okay, so next up, I guess I'll introduce myself here to deliver some of the results from our My Voice Matters engagement survey. So the workforce engagement survey that we initiated in the late fall of 2023 is complete. And we want to talk a little bit about the results today, although there's a larger rollout occurring, and I'll get to that at the end of this presentation. So just to start things off, let's talk about how people fixture within our strategic plan. So as part of Hamilton Health Sciences' strategic plan, the people pillar is focused on engaging, enabling, and supporting our people, empowering our people. And to do that, the engagement survey is a key input in terms of generating descript input from the workforce, from physicians, from residents, and employees about how they experience their work at Hamilton Health Sciences. So across the various dimensions that are listed at the bottom of this slide, there's 14 dimensions. There are sets of questions that each of you that participated in the survey have answered that help us to better understand what matters most to you in terms of your work experience and how your experience is at Hamilton Health Sciences. Next slide, please. So we'll get into a little bit of the results now. Just looking at the response rate this year, we're fortunate that our response rate did increase this year, which is great news. Over 6,500 people did fill out the engagement survey, and as that equates to a 6-point increase for employees year to year, as well as for our physicians as well. So looking at an overall increase in our physician population, our resident participation rate did go down, and we have lots of room for improvement in terms of trying to get our residents to fill out the survey. Okay, next slide, please. So then just thinking about the results in particular, the survey engagement results look at 6 key question areas that are listed across the bottom that gauge overall engagement and experience. Am I proud to tell others I work at HHS? Am I optimistic about the future of the organization? Am I inspired to do my best work? Would I recommend my workplace to a friend as a great place to work? Do I get a sense of personal accomplishment from my job? And can I see a clear link between my job and the strategic objectives of Hamilton Health Sciences? And when we look at the overall total engagement scores, again, good headline news for this year, and that The overall engagement score for the workforce did increase across all those 3 participant categories. 7 points for our employees, 6 points for physicians, and 11 for residents and fellows. And the overall engagement scores are listed there. Also compare very favorably in terms of the overall benchmark that we see from hospitals of our size and stature. Okay, next slide, please. So if we think about the overall experience summary, just trying to drill in and say what are some of the top line results from here, the strongest dimensions coming forward for our employees include safety, teamwork, and the work environment. The strongest areas of results for our physicians and residents are teamwork, immediate management, and safety. And other areas that we think could be an area for strong improvement. Some of the lower scoring areas include work-life balance, mental health, feedback and recognition, and organizational vision and leadership. So areas that we should be focusing on in terms of our improvement efforts. Next slide, please. So the key drivers of engagement, these are the areas of the survey that correlate most directly with high or low engagement. So these are the drivers of engagement, the areas of focus, again, that we should be thinking about in terms of identifying key improvement opportunities or areas where we don't want to lose the progress that we are already making because it is a driver of engagement. For our employees, that includes equity, diversity, and inclusion, professional growth, and mental health. For our physicians, this is our work environment, professional growth, equity, diversity, and inclusion, as well as continuous improvement. And for residents and fellows, the work environment, patient focus, and organizational vision and leadership. So again, these are the factors that tend to correlate most directly with engagement in these different areas. Okay, next slide, please. And so here we have an overall summary of the results that looks at the highlights. And I'm not going to go through all those. I think we've kind of covered that off, but just trying to think about the opportunities from improvement, for improvement. For our employee group, considering the drivers of engagement and the results, as well as the highlights listed here, the opportunity to increase visibility and steps taken to achieve our strategic goals is one area. More opportunities for recognition, recognizing individual and team contributions, increasing our capacity to eliminate job stress. So 3 proposed areas of opportunity for improvement. For our physician group, workplace mental health, work-life balance, increases to opportunities for feedback and recognition. And for our residents and fellows, an increase in their confidence and ability to meet strategic goals of the organization, more visible recognition of their contribution to HHS, and also increasing their desire to practice at HHS after graduation to maximize their investment in training. Okay, next slide, please. So I did say I would highlight what's next. That's a bird's eye view of the engagement survey results, but we are in the process of rolling out aggregate and individualized team results in the broader organization. And how that's going to look is over the coming 2 weeks, leaders will begin to receive their survey results. I think our executive leaders will receive them today and tomorrow, followed by directors and then down to the broader teams. The leaders will share their results with their teams in February and March, and then we'll think about action planning individually and collectively in April. And leaders can, of course, email their questions directly to the My Voice Matters at hhsc.ca inbox. As well, if any of you would like to learn more about the survey, that's a great place to get more information. Of course, there is resources available on the hub too. And as we push out the engagement survey results in that tiered manner, we'll be adding to those resources each step of the way. I think that concludes the slides on the engagement survey. Let's go one more and make sure I'm right. Yes. So just a reminder that we do have our Q&A function open. You can pose questions there. I'm sure there are some already. I haven't taken a look in the course of this presentation, but any of those are being answered by our panelists, and we'll keep going right until the end of today's town hall. And if there's something that maybe comes to mind after the fact that you'd like to ask, you can always email it to hhsnews@hhsc.ca. and we'll be sure to get you an answer as quickly as possible. So now we have the celebrations portion of our agenda, and we can use our chat function, or you can raise your hand and give your shout out live. It's a chance for you to recognize something that's worth recognizing in terms of team or individual contributions, maybe an accomplishment of the organization. Any of our panelists or our participants today are welcome to give a shout out. Leslie Gillies, I see you with a hand up. What would you like to celebrate today?
Thanks, Aaron. Just wanted to recognize Mark Brown, who is our new health professional practice chief. Mark, of course, is currently serving in the JCC systemic therapy pharmacy manager role at HHS. So Mark will begin his new role in March and replacing the irreplaceable Marita Tonkin as she retires the end of February. So congratulations to Mark.
Yeah, thanks, Leslie. Susan, you have your hand up. What would you like to celebrate today?
Hi, thanks, Aaron. And happy to see some of the engagement survey results around safety and people feeling good about the safety. And so this is sort of a safety themed celebration. I just wanted to ensure that everybody is aware of the new workplace safety signage that is being launched today. Some of you may have already seen it. We're working with facilities to make sure that we get those signs up in prominent places at our entrances, and then department heads will also be receiving signage to put up in their respective places as they see fit. I just want to recognize that this has been sort of like a long time coming, and this is definitely in response to feedback that we've heard from our staff and physicians and other stakeholders. And so we're really happy that we've been able to bring this to fruition and launch this as of today. And a special mention to Harjot Aluk and to Veronica McGee, just for all of their hard work and efforts to get us across the finish line with this new safety signage. Thank you.
Yeah, great. Thanks, Susan, for that. I see one of our participants, Krista Bennington, with a hand up. Krista, I'm going to ask you to unmute, and then you'll be able to give your shout out live. So go ahead.
Sure. I wanted to give a shout out to the site admins at McMaster. I'm part of a number of outpatient services, and historically, I feel like the site admin role has often been more focused on inpatients and bed management and things like that. But just over the last weekend, the hemodialysis team is a team I'm part of, as well as one of our complex care teams, and we were able to use the site admins, both Patrick and Deb, on different days to help facilitate patient care, staffing, and actually patient transport for some of our ambulatory patients. So it's just a great example of collaboration across the inpatient and ambulatory settings, and some innovative, just sort of creative approaches that we've been able to use with the support of these resources. So just wanted to say thank you to Patrick and Deb again for navigating those challenging situations over the weekend and evenings.
Yeah, thanks very much. And another hand up in our participants, Leah Morgenstern. Leah, go ahead and give your shout out. What would you like to celebrate today?
Yeah, I apologize if I missed this acknowledgement previously, but I didn't see anything mentioned in Hamilton Health Sciences emails or in our daily contacts, but it was International Holocaust Remembrance Day on Saturday, January 27th. And I think that I especially would be remiss in not bringing this to everyone's attention, that this was not acknowledged by our corporation. So I'm here to say I am acknowledging that it was Holocaust Remembrance Day. Thanks.
Yeah, thank you, Leah, for pointing that out. Very important recognition. We'll definitely investigate whether there's an opportunity to do that either retroactively and certainly on a go-forward basis. So thank you for pointing it out. Are there any other celebrations? Let me check our chat function quickly. Leslie Gauthier, you've got a hand up. What would you like to celebrate today?
Yeah, so good afternoon, everyone. Just had checked the time. Just a number of us got to attend the Medical Staff Association banquet last week, and thought a few things to acknowledge. One was Dr. Thomas Van Helder and Dr. Bill Rostivsky for their organization of the event. I thought it was extremely well done. And then it really important to acknowledge we had 6 physician leaders across HHS who were award recipients from the MSA. And
each of them have truly made gifted contributions to our patients and our teams. And then lastly, just to acknowledge that the MSA is focused on our community, and the charitable donations that they made to City Kids and Neighbors to Neighbors, I think is really important, that everyone understands some of the work our physicians are doing behind the scenes. So thank you.
Yeah, great shout out. It was great to be there that evening. I also point out the art show that
Oh,
showed
the art show.
the talents of some of our colleagues that I did not know, and made me feel a little like I got to up my game in terms of my artistic capabilities. But thanks for pointing that out. And I'll just check our chat, make sure we haven't missed any important shout outs there. I see something from Kelly O'Halloran. Thank you, Krista. I will pass this along to the SAMs with special mention to Patrick and Deb. As well from Marita Tonkin for our health professional recognitions this month. A shout out to our psychologists and recreation therapists. I note from Daniela Troiani as well, happy Psychology Month. I think that's all of them in our chat. I don't see any more hands up at the moment, so I'm going to call it there. Thank you all. Rob, I'll hand it to you for closing remarks.
Thanks very much, Aaron, and thanks all for attending today. Hopefully you found some useful information in terms of the various presentations that were brought forward. Our next town hall is scheduled for March 7th, and we'll look forward to seeing everybody again then. Please, in the interim, take care of yourselves, and as always, thanks for your efforts. Cheers.